So I'll be giving you kind of an overview of what is Virtual Lens, why did we develop this product, and how does it fit into our practices, how we take care of patients, and how does this make our lives better and the lives of our patients better? So we'll jump right in. Hopefully you can see the screen now. So the core of Virtual Lens, it comes at a time where premium lenses are and patient education is incredibly important because we're seeing more patients. Um, Premium lenses add additional revenue to our practice. We have more options out there, and our patients now have expectations like never before. And it's difficult. It's difficult to hire and keep people that can help educate and make this easier for us to convey to patients. So the problems that we have is we don't have enough time. So we don't have a lot of time to help educate patients on these lenses that are incredibly important. They're going to use these lenses 16 hours a day, the rest of their life, every single day. The second problem is it's just very difficult to explain. These are concepts of depth of focus and halos and different photopsias. Regular patients just don't understand it, so it's hard to convey this education quickly and effectively. And lastly, is just the premium lens conversion. Patients don't tend to go for things that they don't understand. So when they don't understand it, they don't see the value in it. And so for clinics that are really focusing on premium lenses, that lack of education leads to people just don't choose premium lenses. So what we're doing now and what we've done since the dawn of premium lenses is we're using pictures, we're using 2D pamphlets, and we're just verbally explaining what it is these lenses do. And these are complex processes that they just don't understand. The challenge with these 2D images is we can't really show them. We're not showing them in a 3D environment. So to look at a piece of paper and understand depth of focus, it's virtually impossible for the average person to do that. So what we've done, where Virtual Lens has come into the eye care space, is we've created a product that allows patients to essentially test drive these different lenses in 3D environments. So they can actually experience the different lens options before they even have to pick them. They can, if you've never had a VR headset on, it's pretty incredible. You can actually see in 3D and depth of focus and see distance objects and near objects. And we can help them understand what a real halo looks like, or a starburst or glare. The other cool thing about it is with these environments, you can put it on if somebody has a dense cataract. You can actually put this headset onto a family member. And if the patient can't wear it, the family member can put it on and they can understand this. So the concept is really simple. Within the product, there are different scenes. So you choose a scene, whether that's at a desk or driving at night, or at a golf course, or cooking in a kitchen. And within that scene, you select a lens that you want to educate your patient on. So you can create a multifocal lens, a toric, a monofocal, extended depth of focus. And then the lens, once you select the lens, you're seeing in 3 dimensions within that scene a simulation of what that lens would look like. So it's very simple. There's 3 steps. Pick a scene, pick a lens, and just let the patient experience it. The difference, the qualities about the program that are really attractive to doctors is it's surgeon specific. So each doctor can create their own lenses and adjust the lens profile to fit what they want the patient to see. For an example, if if you want to show the patients what the halos would look like with a certain multifocal, you can actually adapt the setting for the multifocal specific for that lens and how you want to do it. So you can create your own profile of lenses that you like, And the next doctor in your clinic can create their own profile. You can create as many profiles as you want. It's unlimited. You can create different types of multifocals. You can create a panoptics, an Odyssey. You can create different toric lenses and EDOF lenses. And the last part is it's wireless. So this is a very small device. It's not tied to a computer. It's you can put this in pretty much any space within your clinic, whether it's an exam lane, in the waiting room, or in the counseling room. And it runs on Bluetooth. So if your Wi-Fi or internet connection is not good in your area, it doesn't matter because it runs on Bluetooth. This is it. You can see on the left of the screen, that's the user interface that you see from the tablet. So on the left side of the screen, there's different filters that you use to create a specific lens. And then on the right, that is what the patient is seeing in the VR headset. So the patient will put on the VR headset, and as they move their head around, you're seeing what they see real time in the tablet. So as they're looking left, you see it in the screen. As they look up and down at the book or the mountains, you see that at the same time. Here's another picture of the user interface. It's pretty easy. It's pretty intuitive. And you can kind of see here that there's a lot of different filters there on the left-hand side of the screen. And for each lens that you choose, you go up and down and you adjust those filters to create the lens qualities that you want. Again, this is very simple. This is very small. So this is we've used this in the waiting room. We've used it in the exam lane, and then our counselors also use it. So this is a very small. It's not this giant device. There's some devices out there that are massive. They are the size of an OCT that you have to put in a standalone room to do this. But this is it. This is what you. This is the whole device you're seeing right here. So you can use this virtually anywhere. Pun intended, by the way. So the bottom line here, the benefits is it saves you time. So the patients understand this very quickly and more fully. And in a lot of clinics, we're seeing it increases premium lens adoption. So when patients understand the lens that you're going over and they feel comfortable with the lens and the qualities and being able to test drive it, they can understand the value. And so what we feel is when patients understand the value that they get in a lens, they're much more likely to feel comfortable moving forward and adopting that lens. So and the lastly, and we feel like this is a very big part of it, it improves patient satisfaction. So patients feel more confident choosing wisely the lens that they feel like would fit them best. And so when they get an experience in 3D of this lens, they feel like, okay, I think I understand what you're talking about. I understand what this lens can bring me. And I don't have as much trepidation going in to choosing this lens. So we feel it's a win-win-win. The patients win by better understanding their lens choices, and it really empowers them to choose the right lens for them. For doctors, it's a very quick, reproducible education device, and it just helps patients understand premium lenses or just cataract surgery in general. And the staff tend to like it because it makes their life easier. So we all have staff that, we have different levels of education staff. So almost any staff member could run this, and it makes a very high level of education very easy. And it can decrease your chair time significantly. So there is a time advantage with using this device. We feel like we've wanted to make this to where for most clinics that actually do cataract surgery, this makes perfect sense because if you can help just a couple patients understand to the point where they can feel comfortable choosing a premium lens, it pays for itself very, very quickly. So the monetary return on investments is a no-brainer. The intangible return on investment is faster education. You can use less trained staff, and just you can produce happier patients, which is really our goal in the end. Um, and this is it. This is a real patient using it in our office. We've been using this since last February successfully, and Elderly patients love it. Young tech savvy people love it. It's just been a very, very pleasant addition to our clinic. But I'll stop sharing here. But overall, this has been a really a nice addition to our clinic. We're a very cataract and refractive heavy clinic, and ever since we started using it, it's make our counselors have been a lot happier because they have less questions, they have less time explaining concept processes, and patients on the back end of this, they just feel like, okay, I think they did a great job explaining this. And so we've seen in happier patients, less chair time, and secondarily, we've had a higher premium conversion rate from that.